many things, but as a hobby, I'm an acute medicine consultant working in the Northwest. I'm a husband, a father, and I don't know whether you've noticed, but I'm black. That's why we're here today on the Khan Health Hour. Why don't you, in your chat, why don't you tell me where you're watching from, where you're listening from? I am in the Northwest, as I've said, and we're going to have a fantastic session today. Why don't you tell me where you're listening from? Is anybody listening in the Northwest with me? Is anybody and outside of the UK? Where are we listening from? As we're writing that, I want to tell you, so okay, from Leeds. I want to tell you guys we're going to have a fantastic session today. Has anybody noticed it's got a bit chilly? It's got a bit chilly. For months, my family and I didn't have the heating on, but we've caved in. The heating is come back on, and as the weather changes, then things from a health perspective change as well. We've got somebody listening from London. Welcome. You're very welcome. We're going to have a really, really good session.
You've gone on mute, Ayo.
Sorry, that's they're trying to phase me out, guys. I won't go quietly. I won't go quietly. What I was saying is, we have a friend of mine who she's called Dr. Oge Ilozue. She is a GP partner and trainer and a senior advisor to VB NHSE in London. So not small fry, big fry. Somebody who is experienced, who knows what she's talking about, and she's going to be talking to us today about change of weather, change in habits, and seasonal spread of disease. So if you know somebody who this is going to be interesting for, get the link, send it to them, give them a call, give them a text, paste the YouTube on your WhatsApp and let people know because we're going to have a great time. So without further ado, Dr. Oge, please take it away.
Thank you, Dr. Ayo. So wonderful being back on the Health Hour with Khan. I love these sessions, love the opportunity for us to have a conversation about a particular health topic. So let me share my screen and everyone will tell me that they can see that hopefully soon. And put it on slideshow. Yeah, is that coming up okay for everyone?
Yes, that's perfect. Thank you.
Fantastic. So thank you very much for having me back on in this very special month, Black History Month, even though we know our history goes on every single day of the year. But it is a good opportunity, especially with the changing seasons, to stop, pause, reflect, think about where we're at, think about what we're doing, and make some changes if that's what we need to do. So thank you very much, Khan, for inviting me on. I wanted to introduce myself for those who may not have heard me before. So I am a very proud GP. I love being a GP, love my job. I count it an ultimate privilege. So I'm a GP partner and trainer in Brunswick Park Medical Practice, which is down in North London. I've grown up in London all my life, but I am a doctor with proud Nigerian Igbo roots. I'm also been the clinical advisor with the vaccination program in the London region, working since COVID times, but beyond COVID through other vaccination programs as well. So just increasing awareness, spreading information, giving evidence-based, having discussions. But I'm a GP, so it's about your holistic health as well. And we'll talk about that a lot today. I'm also Barnet LMC chair, so we're kind of linked to the BMA, which is like the doctors' union. So I like advocating and supporting local GPs. I am a very, very proud recipient of the Primary Care Professional of the Year, which I won jointly with the wonderful Dr. Itinu at the amazing Calm Black Healthcare Awards in July. An extremely proud moment, which I will always hold dear. And I also currently serve as the Welfare Secretary for the Medical Association of Nigerians across Great Britain. So it's a group of medic, GPs, specialists, physiotherapists, pharmacists, nurses, all the range of medical, and we're there to advocate and support each other. So just a little bit about me. So I was asked to talk about change of weather, change of habits, the seasonal spread of disease. As we know, we're now in autumn officially. The days are shorter, the dark nights come upon us really quickly. It's a really changing time with autumn. Some people love this time of year with the leaves and the getting a bit cold. I quite like the crisp blue sky when it's nice and crisp. You can wrap up as long as it's not raining or windy. But we're in the UK. We know it's going to be grey. We know it's going to rain. But with the change of weather, it's a time to just reassess things sometimes. But we know with the colder weather and staying indoors more, we are seeing seasonal increased spread of certain diseases. So we always say if you're worried about your health, if you're worried about your family's health, don't delay. Get the care you need this winter. Winter conditions can be bad for our health, especially for our more vulnerable groups if you're older and if you have a long term condition. Being cold can raise the risk of increased blood pressure, potentially heart attacks, strokes. So we want to do what we can to mitigate those risks. And obviously, being cold, damp weather, if your house is not well insulated, it may aggravate any existing health conditions you have and make us more vulnerable to those circulating respiratory viruses we see, especially more in the winter. We're also indoors more. We don't want to go out. We're running to get home because it's dark and we don't like being out in the dark. And that can affect our mental health. So there are a few tips. This is, I'm sure I'm preaching to a well-versed, knowledgeable audience. But remember, our role is to take this information out to our communities, out to our peers, teach our people around us in our churches, in our mosques, in our communities, our workplace, our schools. Our job is to go out and take this knowledge out to our communities and our people. So for me, physical health is tied in with mental health. The two are interchangeable. You can't separate them. So how are you looking after your mental health? Some of you may have heard of something called seasonal affective disorder, SAD, which where people, their mood really dips when the days get shorter, where there's less light. So the winter months can really take a toll on our mental well-being. If you're feeling down, and we all have those days, please make sure you're reaching out and speaking to someone, a friend, family member, or come and see a healthcare professional like me. Or we have our nurses, we have pharmacists, we have care coordinators, we have a much wider team of people available in the practice for you to contact and speak to. Eating well. We all know this, we need to have warm meals in the colder weather. So try to have at least one hot meal a day. Are you eating a balanced diet, really? And as I'm talking to you, I always say this, I'm talking to myself. Are you eating that rainbow of foods, fruits and vegetables? We all hear 5 portions of fruits and vegetables a day. How often are we really doing that? Are we making sure we're getting those lovely greens in, oranges, yellows, reds, purple foods, fresh fruit and vegetables? Staying hydrated. My mother's big thing was drinking water. You're not drinking enough water. Have you drank enough water? So drinking water, the way to test, some people talk about having lots and lots of 3 liters, 2 liters, but it's about the color of your pee. Is it that light yellow color? If it's darker than that, you are not hydrated enough and you need to drink more. And I'm not counting your teas, coffees in this because they contain caffeine and can dehydrate. I'm not counting your juices and your fizzy drinks because they contain a lot of sugar and that dehydrates. So herbal teas, water with lemon, you can have it warm. It's about keeping hydrated and really judged by the color of that pee. Having regular meals and warm drinks can help you keep and stay warm. Keeping in touch. This is my favorite one. We as a African and Caribbean community, we know about community and fellowship. We are not built to be islands by ourselves. And loneliness, one of the saddest things about my job as a GP is going out and visiting people who are ultimately so lonely. They don't see or talk to anyone for days and days on end. So keeping in touch, keeping plugged into community. Are you looking out for your friends, your neighbors, your family members you may not be living with? Reach out. There may be practical help you can offer, getting groceries, helping with handy jobs. But also, if you're not feeling well, tell someone, ask for help. Sometimes we can be quite independent in this environment. We don't want to bother people because we know how busy everyone is. But it's crucial to stay in touch, stay plugged in. And If you have people around, it is about ventilating the room. I know opening that window when that expensive heating is on is a tough one, but it's important to keep well ventilated at times as well if you have lots of people around. But keeping in touch is crucial in these colder, darker months. And we are here to help us healthcare professionals. I know that access to the NHS can be challenging at times because of the demand. There are lots of people out there calling, wanting help, but we are here to help. So if you're worried about your health, if you're really feeling low and it's not improving, come and see your local pharmacist. Our community pharmacists in our high streets are offering so many more services now. You can dial 111 and be signposted to the right care. And your GP, all of us have online access. So you can take time and type out what it is that's really bothering you, and someone should get back to you. Obviously, in an emergency, 999, but in a real emergency. Other tips about this changing season: staying warm. I think I always say, like, the Icelandic or other countries do like layers really well, wrapping up in the proper layers, the thermal clothes, even going to bed in the evening, making sure that the doors and windows are closed at night. If you can, look at insulation, double glazing, all of that, loft insulation. There's plenty of schemes that can help make rooms more energy efficient. Try to heat those rooms you regularly use. I'm looking at 18 degrees. No, I know mine goes up a lot higher than that, but definitely as a minimum. And make sure you are asking for help if you're struggling, because we know it's expensive with the with the bills. There is a worry about cost of living. So making sure you are getting what you're entitled to. You can ask citizens' advice. Our GP surgeries have someone called social prescribers who are plugged into communities and charities and can signpost for extra help. If you're running into debt with your bills, communication and a plan always goes a long way. So it's important to just reach out to the companies and reach out for help. Staying active. We are not meant to sit down all day at our computers working, or not moving, or when we get home we're so tired we're just kind of on the sofa not moving. We're supposed to move our bodies. They say sitting down is like the new smoking. I'm trying to do better with standing desks. I'm even looking into a walking pad under my desk at work because I sit way too long. So again, I'm talking to myself as I'm talking to all of you. So regular exercise can help improve your physical and mental health. And there's evidence that people who are inactive have increased risk of heart disease, strokes, type 2 diabetes, cancers, depression, dementia. See, I always say we can't prevent everything. We can't. Some things are just not in our control. But ultimately speaking, the things that are in our control, we should do. And moving our body, even indoors, and avoid sitting down for more than an hour. So every hour, some of us have smartwatches that reminds us to be active, but ultimately some of us just ignore it too. So we need to make sure we're moving around, even though it's colder and we may be more indoors. There's lots you can do at home to stay active. And then staying well. Don't delay treating minor ailments like colds or sore throats. Ask your local pharmacy for advice. They're very qualified people that can give lots of good advice. If there's lots of bad weather forecast, make sure there's enough medication and food in case that, with tube strikes or bus strikes or snowy roads, just make sure you have enough indoors. So planning ahead is really helpful. Staying safe when you're out and about is really important because there's autumn, fallen leaves, slippery ground. In winter, the ice can really slow things down. So just be mindful when you're out and about walking as well, and looking after those around you. So I'm always about prevention. It was a big theme of my mother. Prevention is better than cure. Your overall health is really important to us healthcare professionals. So things like public health measures. If you're a smoker, have you looked for help to stop smoking? Have you had a discussion about your alcohol levels and making sure you're drinking moderately and within the recommended limits, which is now 14 units for both men and women per week? If weight is an issue, have you approached your GP practice about weight management programs? There's a lot of resources out there trying to get people aware of how to get back down to a healthy weight. Childhood vaccinations is one way. We're protecting against some really serious diseases like measles, mumps, polio, meningitis, diphtheria. We don't want to see these diseases emerge in our society again, and like they do around the world. In school, vaccinations are offered. At the moment, it's the flu that's been offered to all school-age children. And there's vaccinations available for adults. And we always try to tackle the 3 C's. Complacency, oh, that disease is not a problem. Confidence, do you have confidence that this vaccine will do what it says it will do? And convenience, is there proper access? Is it free at the point of care? We are really blessed to have the NHS in the UK. Despite all the challenges, it is free at the point of care and accessible. Is it convenient in terms of fitting around your busy schedule? Have you been for your screening? So screening aims to pick up disease before it even is a disease or before it becomes a problem, or early stages. So it's so much more treatable and survivable. So have you had your cervical screening, which is offered to women with between 25 to 65 years? It's now every 5 years if you're negative for the virus called human papilloma virus. Have you gone for your breast cancer screening? Have you returned your bowel cancer screening kits? And an NHS health check, which screens for cardiovascular disease. So it checks your liver, your lipid levels, which is cholesterol. It checks your kidney function, and it checks your sugar every 5 years if normal. But once you're 40, I'm in that age bracket now, way over 40 now, you need to be making sure you know your numbers, which is my next chart. So your overall health is important. If you have a long-term condition, do you know you have a long-term condition? We have so many people out there, undiagnosed blood pressure, undiagnosed diabetes. So do you know your numbers? What is your blood pressure? We want to aim for less than 140/80, or less if you don't have a diagnosed condition. If you have known kidney disease, we want it even lower than that, for instance. What is your cholesterol level? Are you looking at your diet? Are you making those changes to bring it down if it's high? What is your HbA1c, which is like the average of your sugar over the last 2 to 3 months? Are you in the diabetic level? Are you in the pre-diabetes, which is at risk of diabetes level? Is it normal? So it's important to know this and then make the changes to try to get it back down to normal levels if it's not. What's your kidney function doing? It can be a state of hydration, but it can also be a marker of other conditions. And are you aware of your weight and your BMI? And are you doing things to make sure you are keeping active and being as healthy as you can in that regard? Some of the most common long-term conditions that affect our community: hypertension, blood pressure, raised BP. So common. And it's a silent disease. You don't know you have it until you measure it. So it's really important to get that machine. A lot of community pharmacists are now offering checks. So make sure you know your numbers in terms of your blood pressure. Chronic kidney disease, again, can be silent until late stages. We want to collect it early. I was at a talk with a kidney specialist who was really honest about the fact that his outpatient clinic is filled with the Caucasian population. They're there taking their medication, coming for their reviews, preventing the deterioration. Then when he goes to the dialysis unit, it's filled with all the ethnic minorities because it's late stage and that's what they need. So we want to change that dial and try to reduce the deterioration. And what we need to do is monitor these conditions. Know you have it, and then put the things in place to monitor and optimize the treatment and management of them. Stroke, if you've had a stroke before or a mini stroke, that's another long-term condition that there are things we want to prevent, do put in place to prevent you having another one. Coronary artery disease. Have you had a heart attack before, or something called ACS, acute coronary syndrome? We want to, again, prevent another event happening. Atrial fibrillation. Is your pulse regular or irregular? We all have smart devices and sometimes it picks up on irregular heart rate. That needs to be checked. If you're over 65, you should be having general checks. We should be feeling your pulse when you come and see us in the practice to make sure your pulse is nice and regular, just as a quick screening tool. And type 2 diabetes, lots of us walking around with undiagnosed diabetes, a big burden, but there's so much you can do to reverse diabetes. It's not a must that you must be on loads of medication forever. So with the colder months, we know that viruses spread more easily. We're indoors more with others. So we're already seeing potentially serious viruses circulating in our communities, including flu. And we know that being vaccinated ahead of winter is our best defense, as well as other things like washing hands, opening a window when you can, wearing a mask if you choose to, making sure you're covering your nose and mouth with a tissue when you're sneezing and coughing, discarding that tissue straight away, having disposable tissues at hand. All these other things are nice defenses in our toolkit. But vaccination is a very powerful tool which is available to us. In previous winters, we saw thousands and thousands of people admitted to hospital with flu, and 2,000 were admitted to intensive care units. So this is what we want to prevent. We don't want to see people really unwell. What is flu? We say, oh, I've got flu, I've got cold, but influenza is an acute respiratory infection caused by viruses. Symptoms include, and there are different types of influenza viruses. There's influenza A, influenza B, para-influenza A, B, C. I saw a panel with all sorts, so there's lots of different ones. So symptoms include a fever, cough, sore throat, body aches, fatigue. You usually need to stay in bed. You won't feel well enough to go and do your normal day-to-day. There's the common head cold where you may be able to get up and do your normal things, but flu tends to knock people out and you need to take a few days to rest and recover. It can spread easily, droplet spread, when they cough or sneeze. Flu can cause severe illness. So most if you're healthy, you will recover. You may need a few days of rest, extra fluids, vitamin C, warm drinks, but you recover if you have a good immune system and you're fit and healthy normally. But in a certain population, it can cause severe illness, which can lead to complications like pneumonia or sepsis, which means you need to go into hospital. You're not safe being at home. And in the worst case scenario, it can still lead to death. We forget there was a big influenza pandemic 100 or so years ago where, thousands upon thousands of people died. And the most vulnerable are the very, very young babies, older people, pregnant women, and those with medical conditions. And we know vaccination is the best way to prevent flu and also prevent serious illness with flu. A little bit about how vaccines work. They contain a weakened or dead version of the virus or bacteria, and it doesn't cause illness itself. The vaccine itself can't give you the actual illness. So biologically, that's impossible. We receive the vaccine and it needs our own immune system. So it needs a working immune system to produce antibodies similar or better than if we were infected by the actual virus or bacteria we're trying to protect against. So if we then are exposed to that virus in the future, our bodies are ready. Those antibodies are ready to go and can quickly fight off the disease before it becomes a big problem. So a few facts about vaccination. So we know flu can develop into serious illnesses that affect our respiratory system, in particular bronchitis, pneumonia, or it can make existing conditions worse. We know the vaccines protect against the different types of flu viruses that circulate every year. So some vaccination facts. We know that vaccine preventable diseases have not gone away. They're still there. And if we stop vaccinating, we're going to see it emerge. In London, we've sadly seen measles. There have been outbreaks of measles in pockets where vaccination rates have been low. Vaccines will keep you healthy. That's our aim. They're important to your overall health alongside other measures like diet and exercise. It's not one or the other. Do all of it to reduce risk of disease and keep you well. It can be the difference between life and death. Vaccines are safe. They're tightly regulated here. We monitor them all the time, and we make sure we are actively looking for adverse effects and reporting on those when they happen. They cannot biologically cause the disease they're designed to prevent. There may be other side effects, but they don't cause the disease they're supposed to protect against. Remember, young and healthy people can get very sick too. So even though we have our more at-risk populations, anybody can potentially get complications from some of these illnesses we've discussed. And preventable diseases are preventable. When you get sick, again, remember we're plugged into communities. We have our children, our grandchildren, our parents, others around us. If we're healthcare workers, the patients we look after may also be at risk. And our family, our friends, our neighbors, our community, they need us to be well so that we can also be good parts of our societies. A little bit about some of the vaccines we're offering at the moment. We started a campaign with RSV last year. So that's only offered to pregnant women from 28 weeks. And the aim of that is to protect the very newborn baby, because we've seen some very newborn baby very severely affected by that. And over 75-year-olds, between 75 to 79-year-olds, also started being offered that last September. And you can have that all year round. Flu, we start that campaign in October. So I did my last Saturday, I was doing my flu clinic in my practice. Your community pharmacists are also doing them. And that's offered if you have a long-term health condition. So asthma, diabetes, COPD, if you have a liver condition, epilepsy, all of those long-term conditions. Also offered if you have a weakened immune system. It's offered to pregnant women. And if you're over 65, you're automatically offered it. Shingles, it's another infection linked to chickenpox. It sits in your nerves and it can cause a very painful blistering rash on one side of your body. So it has been offered to over 70-year-olds in recent years, but we're bringing that age group down. And if you have a very severe weakened immune system, you also will be offered the shingles vaccine. And COVID, of course, we all know about the pandemic. We know about the COVID vaccination. Each year, they look at if it's the problem it was, who's been affected. And it appears it's less of an issue than it was. So the cohort of people offered COVID vaccination this autumn has significantly reduced. So you'll only be offered it if you're over 75 years old. It was over 65 before. You'll only be offered it if you live in a care home for older adults, and you'll only be offered it if you have a very severe weakened immune system. So people who are on chemotherapy or radiotherapy for cancer, people who are taking medication that reduce their immune system, things like high-dose steroids or treatment for an inflammatory condition. So if you are diabetic or asthmatic or COPD, you may have been offered it in the past. You won't be offered it this year. You are still eligible for flu, but not COVID. So that's the change with this winter season. So co-infection with two or more of these viruses can lead to more complications. So that's why we want to protect with vaccination where we can. And being winter, you don't know, you think it's the flu, but it could be RSV, it could be COVID, it could be all three at once. So we definitely want to prevent where we can. So who should have the flu vaccine? If you're a carer, if you're looking after a family member, a close friend, or a neighbor who's an older or disabled person who may be at risk, if you get sick, you may pass it on to them. Get your free flu vaccine to protect them. Now, we know that the uptake of flu vaccine among carers is less than 25%. Many of us in our community, we are that. We look after our people. So you may be eligible and you can self-declare as a carer and get it at your local pharmacy or your GP practice. If you have a long-term condition, I've mentioned a few. Also, if you live in a house with someone who is immunosuppressed, so someone who's going through chemo or radiotherapy for cancer, you are also eligible for the flu vaccine, and many people don't realize that. In children, flu can be unpleasant. They can miss school. It can lead to serious complications as well. So every year we offer the very smallest children from 2 and 3-year-olds are offered the nasal flu at the GP practice. And excitedly, this year, they can book it with some local pharmacists as well. School-age children, so from 4 all the way through to 16, are offered the flu nasal vaccine in school. So it goes up their nose. If you don't want the flu nasal one, there is an injectable form available. So because some people from a Muslim or Jewish background don't want, there's a pork remnant as such that may be in the nasal one, but it's very tiny. And a lot of the Muslim associations, Jewish, have said that vaccination is safe and they recommend it. But if you have a preference, you can have the injectable one. So school-age children should have been receiving an invitation from their school. So just some cute pictures with some very cute kids. Every winter, thousands of children who don't have a health condition may need hospital care because of flu still. So children are our petri dishes. They are super spreaders. They catch and spread flu really easily. So them having their flu vaccination can be an important step to protect them and protect the rest of the family as well. So they can now get it at the GP and at their community pharmacist. Check online to see if your local pharmacist has it available. So just to reiterate, the injected winter vaccines don't contain live virus, cannot give you flu or COVID. They've been rigorously tested, constantly monitored. We know the benefits outweigh risks, but it's completely understandable to have questions, to have concerns, to want to do things on an individual basis to make sure you're properly informed about whether it's right for you to proceed with these vaccines. So we say, lots of information and misinformation out there. If you have questions, come and speak to a trusted healthcare professional. I always encourage everyone to build those relationships with your local practice. Even if it's not the GP, there's a nurse, there's a care coordinator, there's a pharmacist, there'll be people based in the practice, even a receptionist that will be knowledgeable and can signpost you accordingly, because we want to be able to give you evidence-based information. And we also want to make sure beyond the vaccine, your whole health is optimized. Are you getting those checks in? Have you had your screening? Are you doing any blood tests? Have you had your medication review? Do you know how to access us in a timely manner when you need us? So we are here to help. So that is all I wanted to talk about. I'm really happy to take any questions and have a discussion. Thank you for listening, everyone.
Quickly as you can. Well done, well done, well done, well done, Dr. Oge. Again, a tour de force of seasonal issues. I think it's really important because if we're not careful, we'll forget that actually the nuance really does matter. The advice that we give in summer is different to the advice that we give in winter, is different to the advice that we give in spring, and we have to be recognizing the signs of the times, as it were, to make sure that we get all the relevant advice in the situation that we have. So I wanted to address something. So before we get all the questions from the listeners, you mentioned before about like it's fine to have concerns, it's fine to have questions and all that kind of stuff. And I think that I see it all the time. You probably see it more than me because people see you before they see somebody like me. Like,
Yeah.
I've started to talk to patients about like the difference between fear and risk.
Yeah.
And really address, this is maybe an anxiety issue. This might not be necessarily a clinical concern. Is that something you've started to see in your practice as well?
There is so much fear. And I think that's why it's important to really have a place of safety where people can come and discuss this with no judgment, because people are scared and people want the best thing for themselves. We all want the best thing for ourselves, but there's a lot of fear mongering out there. There's a lot of confused information out there. So it's really important to be clear about, listen, one, we care about you and your health. That's the key thing. And I think with the misinformation and the mistrust of big bodies like the NHS, there's so much mistrust. You're like, do they really have my best interests at heart? You see the statistics, you see what's going on out there, you see how you feel like you're treated out and about. Do they have my best interests? So it's about really drilling down what's important to you.
Absolutely.
Keeping well is important.
Yeah.
So for me, it's not even beyond vaccination. Why are we not going for our breast screening, our cervical screening? Why are we not preventing cancer before it becomes an issue? Why are we not catching things early? Why are we, we're diagnosed late? So then the treatment is harder, the side effects are more. It's a vicious cycle. So for me, it's a conversation about the whole picture, but acknowledging that people are coming from a place of fear. But then they're unaware of how they're putting themselves at risk potentially, especially if they have multiple long-term conditions. And for me, let's start with, okay, let's just get this optimized then. Okay, put vaccines aside. What's your BP doing? Why is it crazy still? Why are you not taking these tablets? What are the side effects? Talk to me so we can then make a plan that suits you. And it's that communication piece.
And yeah, absolutely. And I think that sometimes on both sides of the conversation, doctors and patients, we need to really drill down on what's this patient actually saying to me. Like I find sometimes, so because obviously I've seen thousands of patients in my career, maybe hundreds per year. And it's not everybody who asks about, oh, does this have side effects? Like you've asked me that. It tells me something about the way you're looking at healthcare. It tells me
Mm,
something about the way you're looking at medications.
yeah,
And there is data to suggest that people who enter a clinical scenario with a positive mental attitude, their outcomes are better than people who are
1,000%.
fearful. In fact, I'm pretty sure there was data to say that even the deaths in COVID, there was a major fear and anxiety component as to the people who were most negatively affected. So it really does matter in terms of addressing it head on. Is this a thing? Am I just scared?
Yeah,
Because one of the things I say to patients, I can't prescribe you anything that doesn't have side effects.
yeah,
So if side effects is the issue, there isn't a solution that I have that will
yeah.
solve that problem. So in terms of like seasonal health, what's your opinion about these things I've started to see on my social media feed? Oranges and lemon and garlic and
You know what? Why are we saying what do just do that? Do it all. Why I
yeah,
want everything that will reduce my risk. So
absolutely,
I've been and my throat was going this week because I've been seeing all the kids and all the people with their coughs. So I've been on my vitamin C. I've
yeah,
had my lemon. I've had my ginger. I've had hot drinks. I've had
yeah.
honey. I added cinnamon. I had cinnamon is great. Turmeric. I put it all
Turmeric,
in
yeah,
there, and I've been drinking that. But I
cayenne
also had
pepper,
my flu vaccine
yeah,
last Wednesday.
yeah,
I'm
yeah,
like,
yeah.
it's not either or,
Exactly,
definitely. And
exactly,
for us, my big thing, vitamin D. We don't get enough sun.
absolutely,
Everyone is low in vitamin D,
yeah, yeah,
especially those of us who are darker skinned. So you should be taking at least 1,000 units a day in the darker months.
yeah.
If you're really feeling tired, if those bones are aching, if you really don't know what's going on, get a blood test to check if you're very low. I've seen levels in in the boots, and then you need a high dose supplement to bring it up, and then you need to maintain. So to me, vitamin D is the main supplement you should be taking. You should be making sure you're getting that rainbow and variety in your diet. It is so crucial. And getting back to those basics, we forget. You should be moving every hour.
Yeah.
I think I see your 100-day challenge. You are a good one. I
I'm
always look
trying.
at that. I think I wish I could be more like that. So
Oh no.
I'm talking to myself because my back, I've been a GP now for 13 years and
Mm,
it's telling on my back. I went from
mm,
hospital medicine to literally sitting down for 12 hours a day.
yeah.
It is not healthy or safe, but I need to be intentional about getting up and moving throughout the day.
Yeah,
So, yeah,
but
really important.
it's interesting you say about intentionality. So what Dr. Oge is referring to is that I'm part of an organization called the 100 Club, and basically it's just guys in their 40s trying to reclaim their youth. But the issue is, so obviously I've had my own health challenges, and the one of the things that I have learned in this season is being intentional about my health. It's my health.
Yeah,
No matter whoever doctor I see, whichever hospital I go to, I'm the one that's going to have to deal with the consequences. And
yeah,
also being clear about like why. So sometimes with health talks, it can seem very punitive. Don't do
yeah,
this and don't do that.
exactly.
But my thing is, I want to be a healthy granddad.
Yeah,
So the journey starts now. It's not when I'm 60. The journey
exactly.
starts today, doing things that will put me in a position to have the health that I want at the time
Yeah,
that I want. I think of it like a bank. I'm going to want to take deposits in 20 years.
yeah.
But what, sorry,
Withdrawals.
withdrawal, thank you.
Yeah,
So what deposits have I been putting over the time to, to do that? So just like Dr. Oge is saying, it's winter. We can't get away from that. And
yeah,
our skin is dark. Vitamin C, sleep,
yeah.
making sure that you get your sunlight, vitamin D, moving. It's
Moving.
interesting. So my opinion is some of the things that we were doing in the village,
Yep.
and we've just become so advanced that these real simple things, having to
That's
walk to mama's house having
Yeah.
to lift something heavy,
Yeah.
you know, all
Back
of these
to
things.
basics, those basics. If we are doing it consistently
Yeah,
and building it into our day-to-day routines, it will make a huge difference. But the
absolutely.
problem is we think it's this big thing and
Yeah,
it's too complicated. And so we do nothing. We literally
exactly.
sit all day at work, we sit on the tube or in our car home, and then we sit at home exhausted. And
Yeah,
it's literally slowly killing us.
absolutely.
So absolutely, we have to be intentional though.
Yeah.
And I always say that I'm realizing once you're after 40, you can't get away with the stuff you did get away with. You
No.
just cannot. It doesn't matter what you do, you cannot. So you have to make those changes, and no one can do it for you. So
Absolutely.
we're here to advise,
Mm,
guide, but I always say that GP consultation is a meeting of two experts. You are
mm,
the expert in your life and
mm.
what you want. What are your goals? Some
Yeah.
people don't think about it. They're on
Yeah.
this rat race of just, stress and work,
Yeah.
but you have to sit back. What is important to you? I love what you said about I want to be what did you say? A healthy granddad. I want to
Fit
be
granddad. Yeah. Yeah.
granddad. So your kids are young now, but you're thinking that far
Yeah.
ahead.
Yeah.
Crucial.
Yeah.
So people need to think what's actually important to me, what is important to me,
Yeah.
and then make changes accordingly because there's no magic wand. So you're
Mm,
the expert in your life, your situation, your dreams, your aspirations. If you've forgotten them, find them. And
mm.
sometimes the change of seasons a good time to sit
Yeah.
and reflect. Actually, we've got 3 months left of this year. What is it I want to do?
Yeah.
How do I want to end this year and
Absolutely.
think about the next year?
Yeah.
And you're the expert in your life, your dreams, your aspirations. If you can't remember them, take time to revisit that.
Yeah.
I'm the medical expert. It's a meeting of two experts. How do we come up with a personalized plan that
Mm,
works for you? There's no point me giving you these 10 medications that you be like, okay,
yeah.
how many home visits do I go on? And it's nicely stacked in that cupboard. You're not taking it. It's a waste of my time. It's a waste
Yeah.
of your time. So
Absolutely.
let's come up with a plan that makes sense for you. But how do you fit it in? For me, that consistency piece is the key
Mm,
thing. And it
absolutely.
needs to be sustainable, it needs to be practical and realistic.
Yeah.
Start small, start with those small building blocks and
Yeah.
build from there. And it
Ab-
can go a long, long way.
And another thing I think is really important to consider is community. So,
Yeah.
like, so one of the things that community gives you is accountability. Now,
Yeah.
every one of us, there's probably areas in our health that we could do better, you know.
Absolutely.
So why not, as by way of suggestion, okay, guys, my friends on my WhatsApp, I'm going to create a WhatsApp group. You guys are going to keep me accountable. So I'm going to post um the I want to take 2 liters of water every day. So I'm going to post everything I drink. And you guys are going to say, okay, did I drink it? I'm going to go for a walk every day. I'm going to post a video. You're going to say, I'm going to do exercise every day. We're going to meet up because our mental health is intertwined to our physical health. So we're
Yeah.
going to meet, we're going to talk, we're going to unburden ourselves. So,
Yeah.
so how can we do that in community? For some people, it's family. For some
Yeah.
people, it's church. For some people, it's think, well, why not start your own thing? Why wait for somebody to say, oh, I wish somebody would start a group in this address. Why don't you do it? Why don't you be the person who is okay, guys, come with me. I want to be healthy. Let's all go together
Yeah.
because you never know the power of your influence. You could be the reason why somebody stops being a couch potato, and their
Completely.
blood pressure lowers, their heart rate lowers, their weight lowers. You can help them. We've got a comment here. There's so much fear. My question is, what does the health system actually do to shift Black people's minds about vaccinations? We
Yeah.
know that we're almost 50% do not engage and more likely and unlikely to get vaccinated.
Yeah.
So I'm sure you have an answer for that.
So no, absolutely, and the data is really clear. They present the data, they present it as inequalities data, so they show, and your white Caucasian population are always the one that are up there, 70%, 80% coverage with vaccination. We, the African Caribbean, African population, are always all the way down. So the question is why, and it's the mistrust. It's to a certain extent access. I think there is access, but people don't necessarily want it or understand why it's so important. So there is a lot of fear about this vaccine will cause more harm than good. But I think that needs to be unpicked. But also, if I put up statistics about how many of us are coming for our breast screening, We are also bottom of that food chain. Cervical screening, bottom of that food chain. So something is not right. Is it the way they're collecting the data, or is it the way us as a community look at health, present for health, and think about our health, think about what's important? But then the data is clear. Black women are more likely to be diagnosed with breast cancer at the later stages, which is harder to treat, and mortality is higher. That data is clear too. So something is not right.
Absolutely.
So we need to somehow figure out a way. And that's why we're here. That's why we keep doing the work. That's why we build health systems that feel more safe. At the moment, it doesn't feel safe for our Black community, and that's just the fact. We are a minority in this country, but we have been bolder since COVID at coming out and saying this is for us, by us, and it's important to then go to your appointments knowing what's important to you and have that discussion. Because even though it's just about vaccination, my point is, why aren't we showing up for all our other tests as well?
Yeah, absolutely.
You know?
I remember in COVID, there was all this talk about the COVID vaccine and this and that, but I remember taking a step back and said, in our community, we've never even talked about vaccines. You know, so in general, so yes, there's fear about COVID and stuff, but this is a bigger issue than one disease, just like Dr. Oge is saying. We need to take care of ourselves. We need to take better care of ourselves, and that statement is layered. That's the we. You know, that's why Khan is here. That's why you have Black doctors like Dr. Oge and myself coming to have this conversation with you. But this is a community-wide problem. You know, so it's not just one person standing on a hill saying, everyone come this way. We're all going to have to change our thoughts, our mindset, and really address what the issues are. I have a friend I met on LinkedIn. It's called Jesse. To answer this point, he started something called Thursday Night Jollof in London. So basically, it's creating a space for Black men to talk about their mental health. So there are initiatives like this all around the country where, you know, people are saying, okay, it looks like whoever they are, aren't helping us. So I'm going to stand up and say, you guys, let's have a conversation. And I think that this is the reason why Khan is putting this stuff out. I told my friend the other day, there's hours and hours and hours of so much good information on the Khan YouTube page. How many of us are forwarding these videos? How many of us are telling our friends, come and watch this? We need to do that and signpost people to this stuff, because even if they aren't doing it, we are doing it. You know,
absolutely.
we need to take it more seriously. But I challenge you to look into your health economy wherever you live. I imagine there'll be something somewhere where somebody's saying, okay, maybe it's not a widespread issue that everybody's taking seriously, but you know, I am. Another comment that's here, you've made a good point about holistic approach, but it's not happening when you go for appointments. Okay.
And I get it. The appointments, there's the agenda. And if it's very doctor or, you know, that specific agenda, then you need to switch it to say, this is what I'm really worried about. And that's why I always say writing it down. And the online consultation, I know not everyone is digital, but there's lots of help, because that's the direction of travel.
Absolutely.
We will be left behind if we don't engage. We're all on our phones, you know? So the NHS app, everything is going through that. So if you don't engage with online digital inclusion, again, that's another element of being left behind.
Exactly.
But think about it. Okay, so that doctor's talking about something. I don't know what they're talking about. They're not talking about what's important to me. Let me write it down ahead of time. So then they can't say they don't know, you know? And if you're not happy with that one, there are other clinicians, you know? There's someone else. So I know it's annoying, I know it's stressful, but keep plugging away and find the right one that you feel hears you.
Exactly. Because this, again, not to be trying and repeating ourselves, but this is about your life. This is it's not gonna be me that deals with the consequences of not engaging. It's going to be you. And I've said before, if I'm in a situation where I feel like the doctor I'm speaking to isn't really getting what I'm saying, then I have to learn how to advocate for myself in a respectful way, because nobody's at work to get shouted at and anything like that. But I'm going to advocate for myself in a respectful way so that they understand what I'm actually saying. I'm also going to, if I hit a roadblock, I'm just not going to stop. It's my health. I'm going to then find another way around it. I've had patients tell me, oh, I've had this problem for a year. I can't get an appointment at my GP. I don't believe that.
Mm.
I honestly cannot believe that you have tried to speak to your GP for 12 months. I don't believe you. I'm sorry, I just don't think you've tried. That's my honest opinion when someone says that to me. I've been trying to know that it's not true. It can't be true. That's my opinion. Back to the point about health. Please put yourself in the driving seat of your life, because you're going to have to, we are all going to have to deal with the positive consequences of depositing our health today and the negative consequences of not doing the things that you could have done today, in 10 years' time. So one last point, Dr. Oge, if you could get anybody to, if there was one thing that anybody could change as we go into the darker month, what was the one thing that you say, everybody do this?
Vitamin D and get your flu vaccine as a bare minimum if you're eligible. Yes. And tomorrow belongs to those who prepare for it today. So what one thing can you do today to prepare for your tomorrow? Because we all want, it's not just about living. We want to thrive, it's not just about surviving. We want to be there for our families or just enjoy our lives with more abundance and joy. So what's that one thing you can deposit today that you can hopefully help withdraw in the coming days?
Fantastic. Thank you so much, Dr. Oge. Thank you for your time. We really appreciate it. I know you're a busy woman, have lots of things to do, but that you've taken the time to talk to us today on the Crown Health Hour. Thank you so much. We really appreciate it. I hope you guys have understood the value that you've had. Again, this video is going to be on YouTube. Please, 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 all of these videos, send it to your family, send it to your mother, your father, your brother, your sister, your uncle, your aunties. Send them the relevant one, or just send them the channel. Please, guys, have a look at this, because we need to take better care of ourselves, and we're partnering with Khan to do that. So thank you so much for listening. I'm going to hand over to Sam, who's going to pull the session.
Hello, good afternoon, and good morning to those watching us right now. Just gonna replace Spotlight. Thank you very much, Dr. Oge and Dr. Aya, for this wonderful session today. I am currently going through what Dr. Oge has been talking about. The change of weather has definitely gotten me, and as you can hear, I'm a bit nasally this morning. So yeah, this was definitely a timely session and something that I needed to hear. And hopefully in the next few days, or at least a week, I'll be feeling much better, focusing on the suggestions that you've given. I may need to get that flu vaccine. I'm still contemplating, but yeah, that's probably on my mind. But yeah, before we just round up today's session, just gonna go through these slides, just talking about what's going on here at Khan for the community, and for anyone interested. So please feel free to contact us or look out on our socials, because we will also be sharing this information on there. Next week, we're having Health Hour, same time, same place. The topic is yet to be released, so please do look out for that information. But we guarantee there's going to be a nice educational session where you can improve your health literacy and share with your friends and family going forward. Today is our Black History Month Gala. I know some of you may know about this event or may have come across it, but we'll be celebrating and honoring Black champions here in Greater Manchester, from individuals to organizations to allies and anyone really that deserve the spotlight for doing amazing work over the last 12 months here in Greater Manchester and beyond. So please do, whenever you see the content that we're sharing, or if you know anyone that's been shortlisted, do wish them the best of luck. And it's going to be a full evening of awards, starting from 6:30 p.m. till late, and it's going to be happening at the Concord Conference Centre. Unfortunately, tickets have been sold out. So please do look out for a new release of tickets for the next round of this event next year, where you'll be able to come and support the shortlisted candidates. We have a session, the Empowered Voices panel session, happening on the 23rd of October. This is focused on the cultural and structural barriers that silence male survivors who've gone through domestic abuse, including those within the LGBTQ community. So if you are interested in listening to the session or taking part in this panel discussion, please do contact dvsa@khan.org.uk or look out for the information being shared on our socials. This is a free event. It's going to be online. Obviously, this is a sensitive topic, so please, whenever you do attend, or if you are going through this, we do understand what you're going through. So please come and get some much needed help and advice, and be in the support of those around you. On the 25th of October, we have the Pink Party. Whether you know anyone that's going through breast cancer, and actually some of you may not know, but it's Breast Cancer Awareness Month. So We kicked off the month with breast cancer awareness health hour session at the start of the month, and on the 25th of October, there will be a pink party in celebration of, those that have gone through this experience and have lived on, or those that have passed. So we're celebrating their life. And this is the opportunity to come and be empowered, get some free health checks, connect with the community, and, you know, encourage those around you to take those checks very seriously. Our community do have a higher death rate when it comes to breast cancer. People pick it up late, and it's not checks that we take often. So we're just encouraging those out there listening to this right now. Just please do those checks. If you feel uncomfortable, if you feel unsure, just contact your GP. As Dr. Aya said, just please keep pestering your GP practices to give you a check, because we don't want our community to keep going through this experience of passing away from late breast cancer diagnosis. So please do attend this session. It's going to be in Gorton, Manchester. If you need any more information, please contact sekinat@khan.org.uk. Again, following the theme of Breast Cancer Awareness Month, and kind of just encouraging the women out there that we do have free workshops where you can understand more of your gynae health, and you get access to Help online, Eve Helpline. Sorry, my nose is nose is impeding me from speaking properly this morning. So yeah, this is an interactive session. It's gonna be online or sometimes in person. So travel can be provided. We can support that travel with some financial help. Please scan this QR code to get some more information, or contact sekina@khan.org.uk, and we'd love to see you at these sessions, engaging with other wonderful women within our community. So now this is a special announcement for those within the Enfield locality. We have a program called Black Health Improvement Program, where we educate healthcare professionals on being a bit more culturally competent when it comes to dealing with our community. I know the other side of the ball, where we as a community don't engage with healthcare professionals, is because we don't feel like they understand where we're coming from, or our culture, or how to engage with us. So we took it up on ourselves as Khan to create a program where we educate healthcare professionals, whether that's in GP, pharmacy, or wherever the healthcare professional finds themselves, in ways where they can engage with the community in a more appropriate manner to yield better results, to help us improve our quality of life and address health inequalities that we all are seeing our community go through. So if you are interested in this, please scan the QR code and get involved, or contact BHIP, that's BHIP-Enfield@khan.org.uk for a CPD accredited session. Within back to now Greater Manchester, I know we're in London for a short session there. Back to Greater Manchester, we do have a Green and Arts Wellbeing service that takes place in Bolton and in Stockport. So every Wednesday it's in Bolton, and every Tuesday in Stockport. We as a community, we're very into much creativity and arts, and this is something that we thought we should bring to the community, where we encourage people to, come out their houses, connect with other people, learn how to crochet, knit, draw, paint, go on walks, go into the garden, and just being a bit more in touch with nature. I know it's something we kind of do struggle here with in the UK, is because of just how busy life is, but there's an opportunity for you to go out there and connect with other people, and improve that creative side of yourself that has to do with art. And if you want any more information, please contact Green and Arts Wellbeing at khan.org.uk. Black History Month. It's Black History Month. For most of you don't know, when you see the banner behind me, we had a Black History Month event just before Black History Month, to kick off Black History Month in Greater Manchester and beyond. So we developed a toolkit which features a calendar that has events from across Greater Manchester. That's Stockport, Rochdale, Tameside, Manchester itself, and Salford. All these places that have events, we've decided to have a dedicated page online where people can go there, visit that website, get get in touch with those doing the events, or sign up for the events and go attend and celebrate Black History Month to a wider array of things. So that's something that we wanted to take on. And we also created a Black Leaders Toolkit, highlighting Black leaders that we thought, deserve a bit more recognition. For example, Sir Arthur Lewis, Nobel Prize winner, one of the first Black Nobel Prize winner. I didn't know about this gentleman until I started doing some research on Black History Month, and obviously taking part in creating this toolkit. We have Reverend Francis, who's a very big, strong community pillar, who's been in the community for over 20 years, just making sure that the community stands strong and they have someone that they can lean on. And she's been exemplary. So we thought that it's important we highlight her. We have Sharon Amacy, who's gone on to, encourage and educate lots of people in the community on how to be how to improve their both professional side and those their individual side, and just being again another strong pillar in the community that we thought we needed to highlight. And then lastly, we have Professor David, who was based in Manchester, but now currently is in Birmingham. But again, it's a nice, strong Manchester pillar. And these are just a few of the people we wanted to highlight during this Black History Month, and go away from the usual Martin Luther King, etc., etc. Highlight people that are currently around us and giving them flowers that they are due. So if you want to know more about the Black History Month going on in Greater Manchester, please visit www.bhmgreatermcr.com or scan the QR code or contact us at info@con.org.uk for more information. I want to thank you all for listening to the session today on the change of weather and how to just stay safe. It's something that I'm going to be taking on board because I definitely have gotten the sniffles and it's not going anywhere. So thank you very much again, Dr. Oge, for this timely session, and thank you all for listening this wonderful morning. And yeah, that's it. Do you have a wonderful rest of your day, everyone? Thank you.
And that's our time for today. Whether you joined us on Zoom, Facebook, LinkedIn, or YouTube, thank you for making the Health Hour part of your Saturday. We hope today's session gave you the right dose of health wisdom that you can share with your friends and family. When we share knowledge, we strengthen our entire community. Mark your calendar. Next Saturday, same time. Got a topic in mind? We want to hear from you at health@can.org.uk. Health Hour, hosted by the Caribbean and African Health Network.